All right, so this is the spine mock. Identify this image. What is the pathology here?
So this is an open mouth odontoid view of the X-ray, which shows a fracture in the dens of the C2 vertebra.
Okay, so what is this? Can you identify, like, why you said this is a fracture?
Because there is break in the continuity of the dens. This is an undisplaced fracture.
Okay. Also, tell me, like you said, this is a fracture of the odontoid. Can you
Yes, sir.
identify in this image what is the pathology?
This is a lateral view of the cervical spine, which shows uh, fracture between the C1 and C2.
Yeah, this is the same image, correct? Same patient, but there is soft tissue edema. Okay, just mention the soft tissue swelling and edema.
Paravertebral.
Yeah. So, can you tell me about this structure number one here? What is this?
Number one, it is the arch of the atlas.
Five,
Five arch, then to the lateral mass of the atlas.
six,
I'll come back to this later.
two,
This is the joint between C1, C2, atlantoaxial joint.
okay, seven,
This is the superior articular fossa of the axis.
and
So
what
six
about
will be
this? Good,
inferior articular
good.
process of atlas.
Okay, now the three
Three is the bifid spinous process.
and four,
It is the body of the axis vertebra.
okay, body of axis. Yeah. All right, let's go for the next one. Can you identify this vertebra?
This is the cervical vertebra.
Okay,
This is the atypical cervical vertebra,
okay. Which one?
which is second cervical vertebra.
Second cervical vertebra. All right. Can you tell me what is structure number two here?
So two is the bifid spinous process,
Seven.
and seven is the lamina.
Okay. And what about this eight?
Eight is the pedicle.
Three
Three is body.
and 10.
Transverse process with the foramen.
Okay. So, uh, can you tell me the atypical features of this vertebra?
The atypical features are the bifid spinous process. The body has a odontoid peg, and
Okay. Thick spine and
thick and bifid spine.
okay, and the body projects upward from the odontoid. Now, tell me which view is this?
This is the inferior view.
Inferior view. All right. So now tell me, what is this vertebra?
This is also the second cervical vertebra from superiorly,
Okay. Why this is superior view?
because number 4 is showing the dens or the odontoid peg
What is the identification
of the.
points of this vertebra?
Sir, there will be bifid and thick spinous process. There will be odontoid peg, and superiorly the articular surface will be rounded.
Okay. So you said this is superior aspect, correct?
Yes, sir.
Beside this body, what else you can mention here? That is the identification for its superior aspect.
Sir,
Okay, no problem, no
I
problem.
think
All
transverse
right.
foramina are seen from below.
Okay. So if you look at this structure number Can you identify this 9?
Superior articular surface.
What about this 4
This is the odontoid peg.
and 2
Thick biped spine.
and 7?
Lamina.
Lamina. Okay. Now, can you see the structure?
This is the atypical cervical vertebra C1, which is atlas.
What is now section number 5? And which side of the, like from which view we are seeing this image?
This is a superior surface because the number 5 superior articular facets are kidney shaped.
Good. What is section number 7 here?
7 is the posterior.
Yeah, posterior
arch.
tubercle, okay? Yeah, arch is
6.
where? Arch is 6, correct? Now tell me, what is section
Yes.
number 3 and what is passes through this area?
This is a groove for the vertebral artery.
Okay. Now, how the vertebral artery will pass through this area?
Vertebral artery will run from C6 transverse foramina and will take a turn and pass upwards superficially through the C1.
Okay, then?
So then it enters the foramen magnum.
After exiting from the foramen transversarium of this vertebra atlas, it will pass over this groove, which is the groove for the vertebral artery, lies over the posterior arch, and then it will pass over to the upward and to the foramen magnum, correct? So now tell me about the structure number 2 here. What is this?
2, it is a articulating surface for the dens of axis.
Okay. So what about section number 8 here?
8 is the transverse process with foramina.
Okay. Now tell me about this atypical feature of this vertebra.
The atypical feature is that there is no body, there is no spine in this vertebra.
Okay. So now can you see this image?
This is the below image, inferior view of the cervical C1 vertebra.
Okay. So why you said this is the inferior view?
Because the articulating surface, which is number 4, is flat and almost circular. Okay. And also I can see transverse foramina from below.
Okay, very good. Tell me about the section number 1 here.
This is the anterior arch of...
Anterior arch, okay. What about section number 7?
This is the posterior tubercle.
Posterior tubercle. All right, good, very good. Now, tell me for the what are the ligaments, okay, that is present between this atlas and the C2 vertebra that we discussed previously?
So there are 3 ligaments, which is one is the odontoid apical ligament, alar ligament. No, these are attached to the odontoid, I guess.
Yeah, I am asking between these two. Yeah.
Sir, I'll come back to this later.
Okay, no problem. All right. Tell me the types of joint that is present between the axis and the atlas.
Plain synovial joint.
Oh, no.
Sir, I forgot.
Okay, these, all right. Synovial pivot type of joint, okay? Now, let's go for the next one. So you missed this one question, which is the ligament between the atlanto C1 and C2, correct?
Yes, sir.
Now tell me the ligament that is attached to the odontoid process.
To the odontoid process, we have apical ligament of odontoid, alar ligament, and transverse atlantal ligament. This transverse atlantal ligament is also between C1 and C2, but C1 and C2 there are 2 more ligaments, which I cannot recall.
Okay, the anterior atlantoaxial ligament and the posterior atlantoaxial ligament, and also the transverse ligament. Just remember these 3, okay? So,
yes.
Right now, we will go to this image. Uh, you want to continue or someone else want? All right. So now, Dr. Saulin, tell me what is structure number 14
Okay.
here?
14 is the one. Seven. So it is the seventh cervical vertebra spine of the spinous process of seventh cervical vertebra.
Okay.
Or
Now, if I bend my head forward, okay, and you started
yes,
from the top of cervical area and below, where you will feel the first cervical vertebra.
the first spinous process will be most prominent of the seventh cervical vertebra
Oh, why is this so?
because of the uh, nuchal ligament.
You said
Because
that.
nuchal ligament is
No,
present
no,
from
no,
the
no, no, no.
C1 to C6.
Wait a minute. I am asking why we felt the spinous process of C7 first.
So it has the longest spinous process.
Okay,
So
good.
that's why.
Okay. So now tell me why we cannot feel the upper cervical vertebral spinous process.
Because the spinous process of the upper vertebra are short, and also they're attached to the nuchal ligament, which is
Okay.
an extension of spinous ligament.
Can you tell me the origin of the nuchal ligament?
I'll come back to this later, sir.
Okay, no problem. So tell me atypical cervical vertebra and the atypical features.
Atypical cervical vertebra are C1, C2, and C7. C1 has no body and spine. C2, the body projects upwards to form the odontal peg, and also the spine is bifid and thick. C7 has a very long spine and the smallest transverse foramen.
Okay. Tell me what is structure number 16 here?
80 higher, 16 trachea, tube, yes, trachea.
Trachea. Then what is structure number 8 here?
It is higher, but higher is not also too far. Should be
This
larynx, sir.
this is the larynx. Okay, this is the larynx. So now tell
Yes.
me uh, about this structure number. There is some bone here, correct?
Hyoid bone, sir.
Hyoid bone. What is the level of this hyoid bone?
C3.
T3. Good. Very, very good. Now, okay. Tell me, you missed two questions basically. So, one question about the spinous process of the upper cervical vertebra. Why we cannot feel the upper spinous process?
Because of the presence of nuchal ligament and origin of nuchal ligament I have missed.
Okay, so these are short spinous processes, and they are embedded within the nuchal ligament. Correct.
Yes,
That's why
sir.
we cannot feel it. Now about the nuchal ligament origin, all right. So it's basically arising from the external occipital protuberance and is attached to the tip of the transverse process of T7, C7. Correct.
Yes.
Now later on, it acts as a which ligament?
Supraspinatus ligament.
Supraspinatus ligament. Very good. There is some muscle attached to this area. Can you name the muscles?
A muscle attached to the spinous process. You're asking.
Okay, give me just 1 minute, please. 1 minute, okay? So, about this, the tip of the transverse process of the C7, what is the muscle attached to this area?
Transverse process of T7. Trapezius.
Yeah, trapezius muscle, okay? Trapezius. So, uh, tell me the how many vertebra make the spinal column and how many spinal nerves are there?
Sir, so the vertebra are 32, and which spinal nerves are 31. C7 for the vertebra it is C7, T12, 5 lumbar, 5 sacral, which are fused, and 3 fused sacral, which form one. And for the spinal nerve, C8, T12, 5 lumbar, 5 sacral, and 1 coccygeal.
Okay, wait a minute. You said the three sacral is fused.
Vertebra, yes, sir.
No.
Sir,
Coccygeal is fused.
5, yes, sir.
Yeah, 7
5,
cervical.
3.
Okay. Okay, so 7 cervical vertebra and 8 cervical nerve. Why there are 8 cervical nerve?
Sir, because the nerves exit, 8 nerve exit below the cervical vertebra.
Because the first cervical nerve arises above the first cervical vertebra. Okay, this is the reason. That's why 7 cervical vertebra and 8 cervical nerve. Now, just remember, okay, the cervical vertebrae are 7 and there are 8 cervical nerve. Thoracic 12 vertebra, 12 nerve, 5 lumbar vertebra, lumbar nerve, 5 fused sacral vertebra, 5 sacral nerves, 3 fused coccygeal vertebrae and 1 coccygeal nerve. Just remember this. But they will ask you this indirectly, like how many vertebrae make the spinal column and how many spinal nerves. So you just mention it like this. Total 32 vertebra and total nerve is 31. What you mentioned in first, okay? Then they will ask you why there is 7 cervical vertebra and 8 cervical nerve. You will answer because the first cervical nerve arising above the first cervical vertebra. Okay. So now about this attachment to the tip of the transverse parts of C7, we have the trapezius attachment and the spinous capitis. Remember, okay? Yeah. Now, who is next?
So yes, sir.
Okay, tell me, which vertebra is this?
So it is a lumbar vertebra.
Why this is lumbar vertebra?
Is the vertebral bodies are large and there is absence of foramen transversarium, and there is also no costal facet for the rib, and there is no any bifid spinous process. So mainly there is no costal facet.
Okay, so there are some characteristic features of this lumbar vertebra, okay? Is anyone want to answer this question? What are the characteristic feature of this lumbar vertebra, please?
And also the spinous process, they don't extend inferiorly,
Very good.
which
So
we see.
first you will mention that the body is kidney shaped, okay? All right.
Yeah.
Now the second
Large.
thing is that you know the. Can you see this? Can you see this area? This is vertebral
Vertebral foramen.
foramen, which is which shape? Triangular shape, correct?
Yes.
Then the third is the transverse process is long and slender. Can you see this one?
Yes, sir.
Transverse was long and slender. Now, about this facet, if you look at the superior facet, it lies to which surface?
Uh,
The posterior facet
superior
lies
and
posterior-medially, correct?
yes.
And if you look at the inferior facet, this one, it lies anterior-laterally, correct? This one.
Yes.
So, this is the other feature. Now, the fifth is that the spinous process, which is this one, it does not go beyond the level of the vertebral body and it is hatchet shape. Okay, hatchet shape. Just remember these 5 features. Okay, they will ask you this one. Now, what are the structures that is passing through the intervertebral foramina?
Anterior. So dorsal root ganglion
Okay,
and its root of spinal nerve,
okay,
and also there is a recurrent meningeal nerves,
very good.
and also spinal artery, which is a segmental artery,
Okay,
and ligament.
and
foraminal ligament
communicating, yeah, ligamentum transforaminal ligament and communicating vein, correct?
and communicating veins and plexus. Yes.
Okay, now tell me, what is the, like, what are the layers that will pass through, or you can say, if you are doing the lumbar puncture, what are the layers that will pass from superficial to deep?
Okay, so first we pierce skin, subcutaneous tissue, and fascia. And after that, we encounter supraspinous ligament, interspinous ligament, and then ligamentum flavum. And we, after we reach the epidural space, we pierce through the dura mater and arachnoid mater, then CSF.
Very, very good. What are the contents of epidural space?
Epidural fat, and yes, sir.
So,
I will get back.
okay, no problem. We will come back to this question. All right. So, tell me about the. Can you see the structure?
Yes, sir.
What is this view?
Um, this is a lateral view, mid sagittal view of the LSC spine
So
and mid
MRI of the
LSC
lumbar
spine.
spine lateral view, correct? Now tell me, which
Yes, sir.
vertebra is this one?
So this is L2 vertebra.
L2. Why this is L2 vertebra?
Uh, After counting from the sacrum, it lies in second.
Okay. So now tell me, what are the features of the sacral vertebra?
Okay, so it is fused and there is no interventricular discs present in the sacral vertebra,
Okay. And
and body are fused.
so there is one another feature. If someone mentioned this,
Another,
anybody, they are fused. There is no intervertebral disc. What else?
The end of dural sign.
End of dural. No. Okay. Just tell me. There is another specific
that
feature.
is
So
Now, Dr. Prabhat.
fusion and
Okay. Can you
slanted,
see? Yeah. Yeah. Go ahead.
maybe slanted.
This is the
Okay.
area where sloping begins. Can you see the sloping?
Yeah, slanted. Yes,
Okay, so
looking.
no discs, they are fused and sloping begins here. Now, Dr. Prabhat, tell me, what is the anatomy of this intervertebral discs?
Okay, so in the center there is nucleus pulposus, and over and surrounding it, it is annulus fibrosis, which is a fibrocartilaginous structure.
Okay. Now, tell me if there is pathology of this, the pathological condition of this
Yes,
intervertebral disc. If there is any degenerative disc disease, what we call this?
we call it spondylosis.
Spondylosis. What is the type of joint that is present between this intervertebral area?
So it is a cartilaginous joint,
Secondary
secondary
cartilaginous joint,
cartilaginous.
yeah. What are the movement on the lumbar vertebra?
So there is a lateral flexion and uh, flexion, extension, and some rotation.
So axial rotation, lateral flexion, extension, and flexion. What is the level of the lumbar, like at spinal cord level in newborn and in adult?
So in newborn it is quite lower, around L3, and in adult it is around L2, L1,
L1. Why is this?
L1. Because there is because when there is growth, there will be a disproportionate growth of the spinal cord and vertebral column. So so the yes, disproportionate growth of the vertebral
Okay,
column and
okay.
spinal cord.
Now, what is the level of lumbar puncture?
L4, L5 around spinal yes, or L4, L5, L4.
L4, L5. Is there any another demarcation for the L4, L5?
Uh,
Supracrystal line, correct?
crest.
Yeah, the
Okay,
supracrystal
supracrystal.
line,
Yeah.
remember, which is lies where?
Around L3, L4, I guess.
So you will answer this like this. Level of the lumbar puncture, L4 and L5 supracrystal line. They will ask you, define supracrystal line. You will tell transverse line between the highest point on the iliac crest and the level of the four lumbar vertebral spinous process. Okay,
Okay.
all right. Now let's go for the next one and tell me what is the contents of the spinal canal below the L2.
Below L2, there will be just CSF.
Can you see the structure, please?
Oh, below L2, sorry. There will be conus medullaris and phylum terminal,
Good. Now tell me what is this structure?
and that is conus medullaris.
Then what is this?
And the upper one is spinal cord, and middle one is conus medullaris.
Very good. Now
Uh,
tell me about this structure. What is this?
that is phylum terminal.
That is chorda equina. Remember, the
Cord.
spinal cord
Yes.
finish at the level of almost L1. Below there will be a chorda equina. Okay, and then we have this area which is the end of the dura. You can say this is the
Phylum terminal.
phylum terminal. Very good. Now let's go for the next one. Okay, anyone want to participate? June, July candidate. Come on. Okay, no one is there. So let's continue, Dr. Prabhat. Tell me
Okay, sir.
about the, you mentioned this contents of a visual space. Can you please tell me about the location of the paravertebral venous plexus?
Yes, sir. It is. Yes, it comes in the epidural space.
Yes.
There is network of internal vertebral venous plexus in the epidural space, and along with other features, other structures like spinal roots and fatty tissue, connective tissues.
Okay. So from here, Dr. Saveline, just classify the location of the paravertebral venous plexus, like how, what are the paravertebral venous plexus?
Oh, you wanted anterior and posterior. Okay,
Okay.
okay. Yes, you can. So
Yes,
the
go ahead.
anterior external.
Go ahead. If you know the
Yes, you
answer,
can.
just
Yes, you can
Okay.
continue.
Okay, so anterior external vertebral plexus around the vertebral bodies,
okay,
and in vertebral process, there is posterior external vertebral venous plexus,
okay,
and the anterior internal is around like running in the vertebral canal anterior to the dura,
okay.
whereas posterior internal is posterior to dura.
All right. So, what are the contents we discussed this question? Contents of the viral space, or you said that I'll come back to this one, correct?
Yes, sir. It is fat, connective tissue,
Okay,
and lymphatics and blood vessels, and
okay.
mainly vertebral venous plexuses.
Vertebral venous plexus and the small arteries. Good, very good. Now, Dr.
Yes, sir.
Saveline, tell me, how does the spinal
Yes,
metastasis
sir.
happen?
Sir, it can be from the Bateman's plexus. Then there can be direct invasion through the intervertebral foramen, and also there can be hematogenous spread.
Okay, so define the Batson venous plexus.
This is a network of veins which connect the deep pelvic veins draining the bladder prostate to the internal vertebral venous plexus, and these are valvulus veins.
Okay, so how the tumors metastasize to the spine.
Uh, Tumor metastases to the spine are the breast, lung, bronchus, thyroid, prostate, and kidney. while the prostate lesions are sclerotic in nature. Otherwise, the other lesions are lytic in nature.
What are the structures at the level of C6?
There are two tubes, two arteries. The two tubes are larynx and pharynx, which terminate, and two arteries are the termination of vertebral artery, and the other artery is the. I'll come back to this artery later. And otherwise, there is one vein which is the inferior thyroid, middle thyroid vein. The artery was inferior thyroid artery, and the
Okay,
yes,
so yeah, okay, no problem. We'll come back to this question to be specific. Okay, now
yes.
demonstrate the boundaries of the posterior triangle on a subject. What you will tell the patient? How will you demonstrate it on the subject?
I'll instruct the patient to look over, to turn the neck to the other side and then tense the neck. And after tensing the neck, I will palpate for the sternocleidomastoid muscle extending from the lower lobe of the ear to the clavicular head,
Okay,
and then the base of the mandible. And sorry, I will palpate the trapezius muscle from the lower lobe of the ear to the clavicular head, and then the base of the mandible, and also the posterior margin of the sternocleidomastoid.
so you will ask the patient to look to the contralateral side and the impression of the sternocleidomastoid and trapezius muscle in the posterior triangle.
Yes, sir.
Okay, so how will you demonstrate on a living subject the hyoid bone? We already discussed this, correct?
Yes, sir. We'll
Yeah,
ask the patient to look up.
yeah, we discussed this.
We'll
Tell me
ask
about
the
the
patient
cricoid cartilage. Like, how will you palpate the cricoid cartilage?
we will ask the patient to look up, and I will palpate for the most prominent cartilage, which will be thyroid. Then one finger below that, I'll feel for the groove, and which will be for groove will be for the cricothyroid membrane, and immediately below that groove there will be cricoid cartilage.
So the prominence that you will feel immediately is the laryngeal prominence. Okay, all right.
Yes, sir.
So now about this one question, can you tell me, Dr. Prabhat, about the structure that's found at the level of C6? That's the last question of this session.
Hello. Yes, sir.
Yeah,
Hmm?
structures at the level
Okay.
of C6.
Okay. So at the level of 6 there is a cricoid cartilage, and there is a termination of the pharynx and beginning of the esophagus.
Okay,
And also there is a termination of larynx, which are marked by cricoid cartilage, and beginning of trachea.
okay,
And at level of C6, there is a yes thyroid to thyroid inferior thyroid artery enters the thyroid gland, whereas middle thyroid vein emerges from the thyroid gland,
okay.
and vertebral artery enters transverse foramen transversarium in level C6.
Very, very good. Both of you, superb job. Okay, very good. Keep it up. And that's it. We finished.